that weight does not equate health. So discuss this more and in detail. Medical doctor Sandy Van. All right, Dr. Sandy, I'm so happy you're with us. Why are people so obsessed with BMI?
I think it's because it's so simple. It accounts for its body mass index, it accounts for height and weight. It's a simple calculation, and historically we've used it for large-scale population studies that look at relationships between, weight and health, like cardiovascular disease and things like that. So it's useful as a screening tool, and I think that's why it is a screening tool, but it has its limitations, of course.
Yes, we've been just sort of mentioning that quickly off the top of the show.
The most notable criticism being that it doesn't really distinguish between muscle and fat, so it's easy to misclassify somebody as having obesity. For instance, the classic example is a bodybuilder.
Why was it created, BMI?
It started in the early 19th century by a Belgian mathematician and sociologist named Adolf Quetelet. And he was really just trying to figure out a rapid calculation to measure volume of man. And then it gained popularity by a physiologist named Ansel Keys. He was using it to study trends in dietary patterns and cardiovascular disease in European and male populations. So by virtue of that, you can see why there's scrutiny and why it's a little bit concerning when we're using it at a broader level of amongst diverse populations or in insurance policies when we decide on what premiums to pay when people have certain BMIs. We're gaining headway now because I think that we are accounting for some of the limitations of its use. So it's just a screener nowadays.
It's just a screener. Okay, so we are kind of moving away from using it specifically to make the kind of judgments that, could be kind of life-changing. If your insurance is based on it, if your doctors are saying you're obese based on it, we have to sort of look at more than BMI these days to figure out someone's actual health. Am I right?
100%. And I have to apologize on behalf of the medical community because I think somebody was mentioning that it was really a frustration for her that we do that still. So conventionally we have in the past talked about BMI and ideal body weight, but we're moving away from that. We need to look at obesity not only by BMI, but accounting for the fact that it's excess weight that might impair somebody's health. So if you have a BMI of 30 and there's no other parameters that are, a red flag, then that by definition isn't necessarily something that has to be treated with weight loss. And I'm a weight management physician, right? So I think that we have to look beyond the scale and at other things like blood sugar, blood pressure, vitality, strength.
How has BMI affected women in their approach towards health and weight loss, do you think?
Yeah, in my practice, when I see people for weight management, there's this ubiquitous, long-standing history of body image dissatisfaction, regardless of the BMI they've been at. And I think that's because our media and the way that certain people are brought up and the dieting culture have really infiltrated our mindsets and our self-evaluation about our weight and self-worth. So I try to really extinguish that and talk about BMI as a crude measure. It's not the best proxy for health status. And to really help people understand that BMI is not a choice. It's influenced by so many things, genetics primarily being the main one. We know that when people have two parents with obesity, their risk of developing higher body weight is up to 70%. And as a reference point, height is up to 85%, right? So nobody complains about their height in the same way they complain about their weight, but there's other things. There's medical problems, there's psychological problems that can influence it, environment, socioeconomic status. So BMI is not a choice. So we got to stop chasing it as the one thing that determines our success with health.
We were talking before the show about the fact that you had gestational diabetes.
Yes.
And you're lean and probably always will be lean.
Right.
You come from lean folks.
Yep.
It's in your genetics.
It's my genes, yep.
So it just kind of shows you, though, what is in what your weight is not necessarily indicative of your level of health.
No. I am working all the time to prevent type 2 diabetes because I had gestational diabetes, irrespective of my weight.
Yes.
And that's the thing about the BMI categories. Classically, they weren't identifying variations in ethnic groups. So now we know South Asians and East Asians might have lower BMI cutoffs that put them at higher risk of health problems. So for me in particular, that's a good example of how heritable something could be.
Absolutely. I like the fact that we're moving in the direction of using BMI less or using it with a whole bunch of different factors.
Right.
Would you say when people go into their doctor, they should sort of arm themselves so they can advocate for themselves beyond BMI?
Always.
Always.
Always. Because the best teachers are our patients.
Yeah.
I learned so much from my patients. And so, yes, patient advocacy is important, but I can understand if somebody is a little bit trepidatious about doing that, because it can be a really difficult and sensitive topic.
Dr. Sandy Van, thank you so much for that.